What questions are asked in a dementia evaluation? When preparing for a dementia evaluation, it is important to understand what questions may be asked. These questions are designed to assess cognitive function, daily living abilities, safety, and medical history. They help healthcare professionals identify symptoms, rule out other conditions, and understand how these changes impact daily life. First, questions about memory and cognitive changes are common. You might be asked if you are experiencing confusion or memory loss that seems to be worsening. You may need to recall recent events or conversations. Questions about your ability to concentrate, solve problems, or make decisions are also typical. You could be asked if you notice any changes in your language skills or if you can name common objects. Additionally, you might be asked to draw simple shapes or clocks. These inquiries assess various cognitive skills, often using tools like the Mini Mental State Examination or the St. Louis University Mental Status Exam. Next, daily functioning is a key area of focus. You may be asked if you have needed help with basic activities like eating, dressing, or bathing over the past week. Questions about more complex tasks, such as managing finances, shopping, or taking medications correctly, are also common. These questions evaluate how cognitive changes affect your independence in daily life. Safety and behavioral concerns are another important aspect of the evaluation. You might be asked if you still drive and feel safe doing so. Questions about whether you take medications as prescribed or if there have been safety concerns in your home are also relevant. You may be asked if you have gotten lost in familiar places or if you live alone. Assessing these risks is crucial for planning care. Input from family members or caregivers is often sought during the evaluation. They may be asked if they have noticed any changes in your memory or behavior. Their observations can provide a fuller picture, especially if you have limited insight into your condition. Your medical and psychiatric history will also be reviewed. You might be asked about any recent changes in mood, such as feelings of depression or anxiety. Questions about past strokes, head injuries, or neurological conditions are important. You may also be asked about medications that could affect cognition or any recent infections. Finally, understanding the duration and impact of your symptoms is vital. You may be asked how long you have noticed these changes and how they affect your daily life and independence. This information helps differentiate between dementia and normal aging or temporary conditions. In summary, a dementia evaluation involves a comprehensive set of questions that cover cognitive abilities, daily functioning, safety, medical history, and input from caregivers. This thorough approach aligns with current medical standards for diagnosing and managing dementia and memory loss. If you or someone you know is undergoing this evaluation, it is essential to consult healthcare professionals for personalized advice and support.